Namaste. Good evening, everyone. I am Shruti Bharadwaj, a proud volunteer at Project Step 1. I welcome you all to yet another fabulous webinar session. I welcome our speaker of the evening, Professor Yaneer Bar-Yam. You all must have seen him by now. He's the founder of endcoronavirus.org and advisor to various governments for COVID-19 containment. He's the president of New England Complex System Institute, MIT-physicist and complexity scientist. He had warned about the global pandemics for about 15 years now. He's led the outbreak response protocols for stopping Ebola in Africa in 2014, which worked. I welcome you, Professor, and thank you so much for coming here again and agreeing to share your experience with us. Before we start, Project Step 1 now needs no introduction. Project Step 1 is a volunteer-driven, non-profit collective of individuals from the startup community with volunteers and doctors from across India to provide free access to healthcare via telemedicine to the citizens affected by COVID-19 pandemic. The ongoing COVID-19 pandemic has made humanity face unprecedented crisis, but our doctors and the medical teams have proved to be the heroes over the past 180 days. Our Project Step 1 doctors have made great impact on 5 million lives, have done more than 800K consultations, and have been successful in preventing more than 500K contacts. Dear doctors watching this webinar, Step 1 and the citizens need just 30 minutes of your every day. Your 30 minutes every day can save thousands of lives. Give a missed call to 080-471-92219 to join the largest doctor volunteer group. Thank you so much. About today's webinar, Step 1 has covered on all the vital topics that has helped us in the mission of telemedicine and also helped the doctors on this platform to upgrade to any new developments, learnings in the clinics and hospitals with respect to COVID-19 and other health awareness. We are focused on the need for the citizens to be upgraded and to know the do's and don'ts during this pandemic, keeping in mind to raise awareness. This webinar is an overview of the entire series. It's about stopping COVID, global experience, local action. I now hand it over to Professor Yaneer Bar-Yam. Over to you, Professor.
Thank you. Thank you. And I very much appreciate the opportunity to discuss the current situation. So we had a meeting a couple of weeks ago, and today I want to focus mostly on a different topic. So the first discussion is about the disease in general and how we can prevent transmission and stop the disease. And I want to summarize what we talked about last time briefly, and then and I welcome questions on that topic. And then I also want to focus today on the topic of long COVID, which we didn't have a chance to talk about last time, and is also something that is extremely important for telemedicine and for addressing the challenges of the outbreak, and also informing people about what are the harms that can come from the disease, so that people take strong action. So let me summarize. First of all, the disease is a terrible one, both deaths, the disease, and as we'll talk about today, the long-term effects of the disease are very severe. And it also spreads very rapidly, so that it may seem like there are very few cases at some point, and then within few weeks, there are many, many cases, and the impacts are very severe. The second point is that in order to address the outbreak, we need to take strong action. And it's important to understand that if we do take strong action, we can get rid of it. It's not easy. It's surely a challenge, but it's also not a challenge that we cannot overcome. It is something that we can overcome And that's super important to recognize because it can give us hope and it can enable us to galvanize action. And so the third point is indeed that the action really has to be a shared responsibility. So we know that people think that government has to take action, and indeed it should and really must. But the communities, within the communities, is actually the most important location of action because the transmission is in the community, and individuals in community can take the most important actions to stop it, but they have to have the right information and the right support. And that is a responsibility of institutions, of corporations, and of government. So it's a shared responsibility of all of the aspects of society. And then, of course, in order to stop the disease, the key thing is to prevent transmission, meaning to avoid sharing air, touching surfaces, and using masks, isolating people who are sick rapidly as soon as there is any indication of illness or opportunity to test. There must be safe essential services and, of course, care for those who are sick. And then I asked ahead of time whether there were questions. I was told that there were already questions that were asked, and one is the questions that was asked is how did those who previously experienced SARS do better? And the answer is that they knew that the main thing is the focus on getting to zero, because only at zero can we open safely. And so that's a really key understanding, that if you have that understanding, it gives you a tremendous advantage, because if you have even a few cases of transmission in the community, and you try to restore normal activities, social, economic activities, the rapidly the cases grow. So the key thing is to really focus on getting to zero. And part of this is using travel restrictions. Travel restrictions and establishing zones that don't have cases make it possible to get to zero locally so that areas can open up safely. So if we try to do everything all at once, it's not being that we shouldn't try to do everything all at once, but if we don't separate areas that are successful and allow them to restore normalcy, then the burden of fighting the disease becomes insurmountable. And so the key thing is to make zones that are safe and protected by travel restrictions so they can open up, restoring economic and social activities and helping other areas that still have cases to get to zero as well. And finally, in these introductory remarks, I really want to say that a key part of all of this is not just saying that there are communities and institutions and corporations and government that need to work together, but connecting them in an effective way. And it's really important what is being done with a volunteer telemedicine effort in connecting individuals, community, health institutions. And the centrality of that makes what everyone is doing who's working together to do that super important. So I appreciate very much what Step One and your efforts are doing, and galvanizing everyone to participate through your efforts is incredibly important. So that's my brief introduction. I hope it's clear, it's very concise. It was just a summary, but what I want to do now is spend some time on long COVID and then open to questions, which can be either on the first topic, how do we stop the disease, or on the second topic of what do we do in the understanding of what is the understanding of long COVID and what can we do about it. So long COVID really describes the long-term consequences for those who have the disease. And we have it already significant information about what is happening. Though, of course, it's less than a year since the disease was discovered, and we are sure that there will be much more information that will be learned. But in the meantime, what we know is that the disease is not just an acute disease. It's not just one that affects one for a few weeks and then goes away, right? People think that you either get better or you die, but that's not the case. There are many people who are sick, and this includes people who have very mild cases, even people who have asymptomatic cases, who end up with very long-term effects. And those effects include symptoms that include difficulty doing normal activities because of fatigue, tiredness, because of headaches, because of shortness of breath, because of confusion called brain fog. And there are people who cannot get out of bed, cannot get to do work for more than a short amount of time. And surely people were in pain on a constant basis. And then there are biologically, medically, what we find is that people have damage to their lungs, to their heart, to their brains, to their kidneys, to other organs. There's indication of loss of male fertility, and there in general, and lots of other harm to intestines and so on. I didn't mention there are gastrointestinal symptoms and fever that continues for a long time. So there are many, many symptoms that are severe, and the harm that is observed is also very widespread. So studies have shown that there may be significant symptoms for months, and the percentage of people we don't know yet, but it may be 10 or 20%, it may be 50 or 80%. And that depends also on what question you ask. And we don't know the healing process. It's, of course, expected that there is some healing, but it's also expected from the biology of damage, in particular to heart tissue. The heart can be affected, tissue can be affected directly with cutting of muscle fibers and death of cells. And the heart doesn't repair itself very well. So the experts are saying that that's lifetime permanent damage. And we know that neural harm that may be taking place may also be very long-term if healing is possible. So we're looking at long-term disability. We don't know whether the healing process will be strong or weak, how far it will go, and we don't know whether there will also be deterioration. We already have reports of people that seem to be fine for a few months and then began to have symptoms that were quite severe. So all of this is very devastating for people's lives, and it's very concerning for the society how it will support the people who have long COVID and to address their needs, their support, and the harm that we will face as a society in in responding in both the fact that they have this long-term effect and that we have a responsibility to help them. So that's a short summary of long COVID. Again, maybe I'll give a little bit more detail. There are studies of, as I mentioned, the heart damage that use NMR, magnetic resonance imaging, that show inflammation of the heart and what is called involvement of the heart, meaning there's change in the heart, there are arrhythmias that are being observed, and there is indication of significant heart damage in a large proportion of people who have cases. And there have been a number of people who have died, including young athletes, by sudden death, indicating heart attacks, heart effects that can affect young, healthy, previously healthy individuals. So this is the heart situation. In the context of brain effects, we see that there is change. There are studies that show there's change in the internal structure of the brain, including the hippocampus, which is responsible for spatial navigation and setting of long-term memories. And there is damage to the insulae, which are responsible for emotions, and when there's damage there, there's often effects, including inappropriate panic and depression, and difficulties with relationships. And of course, as is common, there's harm to the olfactory center, so smell and taste are being compromised for long periods of time, and that can be indication of other, it's a symptom of other kinds of diseases and long-term effects that can be hard to cope with, such as just knowing where there are toxics, smells or foods. So it is a significant harm to people's well-being. So then there is harm to kidneys, harm to indication of harm to male fertility in some studies, and gastrointestinal problems, as I mentioned. So this is a brief summary. The medical aspects, the symptomatic aspects are not yet fully understood, of course, and we do not know how it will progress. It's just a few months that we have this information, but we cannot assume simply that it will just get better, though there are some indications in healing in some people. And it's important to understand that this has effects across ages and across symptoms of the disease. There is a new study that I want to highlight because there's been a lot of confusion about it. We know that there was a study in India previously that showed that children are transmitting the disease and are infected. There's a new study in Israel that documents extensive transmission. What seems to be happening in studies that have dismissed or have said that children are less affected is two things. Number one, of course, we see that they're not dying at the rate of adults or elderly in particular, but they often are asymptomatic. And since the proportion of children that are asymptomatic, or at least they're not reporting symptoms, which of course is not the same thing, that children also can be infected, also can transmit the disease even at young ages. We don't have all the information yet, but because they're asymptomatic, many studies have not shown the results. And so the literature is full of statements about children being less infected, and that may be very wrong. And we do not know yet much about the long COVID effects in children, and this is something that we still need to understand and discover. There is a call for reporting about the effects in children, and of course, because children don't always report what they experience because they don't know what's the difference between normal and not normal, we have to do careful inquiry to understand what is happening. So this is my summary. I want to spend a few minutes talking about what telemedicine can contribute in the context of long COVID. I have a few notes, and maybe you have questions. These are still in development. So first of all, it's super important to acknowledge and affirm the existence of post-COVID infection effects and symptoms. There's been a tremendous denial in the medical system across the world of such effects. And the reason is that if they don't know about it, they wonder if it exists. And in known diseases, it's very common for physicians and the medical system to say, well, you must be imagining it because we haven't heard about it before. But with a new disease, that's not appropriate. And indeed, the medical system is now beginning to understand and should recognize and acknowledge and support people, because the denial of the reality of the long COVID symptoms and effects and harm is itself a harm, because people need to understand that this is real and need to prepare themselves and to engage in the challenges of addressing this situation. The second thing, so the first thing is to acknowledge and to affirm this situation. The second thing is to connect people to medical support, because there is need for careful understanding of what the conditions are, whether it's the heart conditions or other conditions, so that they can receive the appropriate medical care. It's also important to connect people to online groups that are providing mutual support and tremendous amounts of information. There are many large long COVID groups that have been established. And people need to be connected to disability support systems. Their ability to work may be very well impaired. Their ability to do even normal activities may be really difficult. And they're subject to sudden changes in conditions. So they need to have support systems that will help them. And in this context, it's super important, number three, to encourage them to be open with others, to let other people know about what's going on, so that they can receive support and care from family and friends. There is a big challenge with stigma, with disbelief, and with knowledge about what's going on. And we need to find ways to have people support each other in their homes and in their communities, and as well as in the medical system and in institutions. Number four, we need to keep records. We need to have the information about what's going on. For them, they should keep records about their own conditions, people who have it, and the medical support systems need to have that information. And finally, number five, we need to be open to learn, because we don't know enough about what's happening. And by gathering information and by knowing what's happening with individuals and recording that information and sharing it, we hopefully will learn more about what's happening and be able to address it better. And finally, And of course, centrally, we need to prevent more people from getting long COVID. And that really means preventing people from being infected. And that goes back to my first topic of preventing people from getting the disease and stopping the outbreak and opening without cases. And in order to do that, one of the things that is important is letting people know about the consequences, because long COVID is one of the aspects of the severity of the disease that should make people take extra care. People should understand that they are at risk, that everyone is at risk, that everyone can be harmed by the disease, them, their families, their friends, their community, and to take very strong action, the maximum precautions in order to stop this outbreak. So that's my summary. I've taken about half of the time today for this summary. I would be welcome questions that we can talk about what to do.
Thank you, Professor, for such a brief introduction. Now, the question is so you have led the complete protocols for stopping Ebola in Africa in 2014. So, can you share some of the learnings or protocols that can be implemented in India for COVID? Do you have any such learnings that you can share
Yeah,
with
the
us?
main thing were two things that we learned. One is that many people will say that we cannot get rid of it, and they're wrong. And we know already from this disease, there are countries that have been successful. It doesn't mean that it's easy, but being able to do it is super important to know. The second thing is that the activity is mostly in the community. If you can galvanize community teams, members of the community, to take responsibility, and one of the key aspects of it is being in touch with each other, the door-to-door process. And door-to-door has risks that people have to be protected from transmission by PPEs, but going door to door as a process is super important. And it's also true if you call people up to find out, it's very important to be in touch with people frequently. And there is no institution, one institution, the healthcare system doesn't have enough people to do everything that's needed. So having members of the community and the community as a whole take ownership of their involvement in stopping the disease is incredibly important. And letting them know that by their action, they can do things that are important and that will stop the disease is helpful, is super important. And so if we inform them and if they gain the understanding, they should help. And the communities can support each other. So if people share information between communities, in West Africa, they had neighborhood teams that would go door to door to look for symptoms and to identify needs of people. Right. You want to check on the medical situation, but you also want to check on other needs that people have so that they can be helped. And in doing so, um, uh, those teams would also involve neighboring community teams, so that neighboring community teams would participate in weekly meetings, individuals to cross-fertilize knowledge about what to do. And there's no one, even though I have experience in Ebola, multiple outbreaks, and in coronavirus, and we know about SARS, nobody can tell the community how to solve their problems. They have to adapt and learn how to deal with the circumstances that they have to face. And the best thing is that they're making rapid improvements in what they're doing and sharing with others what they're doing. And at the same time, there's involvement of the experts, the outside individuals, to share information that we're learning more generally and to support and to provide key knowledge, but also to learn from what they're doing so that you can share it in other places. So that's what we learned in West Africa and the Congo. And the key thing that I've found most people don't know is to start by asking. If you have a patient that comes into the office, to a doctor's office, what is the first thing that you do? The first thing that you do is you ask, what's going on? It's obvious. When people go to a community, for some reason, they start by telling them what to do. And the answer is, that's the wrong place to start. You always have to start by asking the question, because you have to know what are the challenges people are facing in order to be able to help people and find out what you need to do in order to be helpful. There may be problems that have to be addressed first, whether they're economic problems, whether they're social problems, other problems. And knowing that those problems must be addressed before you can get to addressing the disease is super important. And then we have to address the problems together. That's what I have to add.
Thank you so much, Professor. So we have to fight COVID as a community and we have to support each other. So talking about asking questions and sharing with each other, there's a question which is, what psychological effects have been noticed in COVID patients and how should the doctors and the families be prepared?
Say, what is the first statement? You asked
What
someone.
psychological effects have been noticed in the COVID patient?
Psychological effects?
Yes.
Yes. So yeah, I started by talking about in the long COVID. You're talking about in patients.
Yes.
Yes. So while I mentioned that there can be depression and brain fog and other anxiety and so on, there are studies, there are articles that have talked about the psychological effects. And I don't have all the information in front of me, but they can range from what we usually associate with individual situations to how they affect families' interactions because of relational issues. And so part of the problem is that the effects can be very diverse. And so there isn't just one thing that could happen. And so you have to be attentive to what people are saying, because there can be many different physiological systems and many different psychological symptoms. If someone would like, there's an article. Let me see if I can find it. There is a new research, not so new, but about a month and a half article ago, of psychological systems. Maybe you can post it later because I should give a reference. But there is a study that shows that there is a large proportion of people that have various psychological effects after COVID and the post-COVID times. During the acute time, people can go through very, very bad situation with psychological effects where they become um, very confused and unable to understand what's going on around them. So these are things that are part of treatment. It's often attributed to be part of the medical treatment, but it seems to be more direct, having to do with direct impact of the virus in the brain. Viral particles have been found in brain tissue. So there is direct effects of the virus in the brain. There is more indirect of the inflammation effects. And of course, there can also be effects of the use of medications and the treatment that are being used. But I don't have more detail for you about that.
Well, you can share the link with us, Professor, and we will definitely put it across so that it will help all our viewers. Uh,
Yes.
so most countries which had the previous experience of pandemic or SARS seems to be handling COVID spread much better. So what are they doing differently than what India is doing?
And again, the main thing is that they're acting fast because they know that the disease is fast and terrible. And so it's important to act as soon as possible. It's like when you have a few cases, if you stop them, then it's much better than waiting until, unfortunately, as we know in India and in other places, there are many thousands and 10,000s of cases. So acting fast, but when it's big and you have 10,000 cases, it's still the faster you act, the stronger you act, then you end up having few cases. And the point then is when you have few cases, not to stop. It's like having a fire in the house and walking away and saying, okay, I only have a small fire. I can go and have lunch, right? No, you get it out completely, even if there's another fire later. And this is one of the confusions. You say, well, if so, there'll be new cases because somewhere in the world there are cases, they'll come back. And the answer is yes, there may be a fire in the future, but if there's a fire in the future, we'll fight it then, and we'll again fight it as fast and aggressively as possible. And again, if we make progress and we get to zero someplace, and much of India didn't have cases at some point, we need to really protect it as much as possible with travel restrictions. There's always essential travel that's needed, but if we protect the areas that are without the disease, we can then expand those areas by adding other areas that don't have it. And these are things that have been done in the countries that had the experience with SARS, and these are things that have been done in countries that took very seriously and acted upon what others were doing. So it's Western countries, Eastern countries, all kinds of small, large islands, countries that are part of the mainland. It's really a question of decision and getting there. Yeah.
Thank you, Professor. So, India was one of the countries which took the fast decision of making a lockdown as soon as there were few cases of pandemic. So, with recent rise in COVID cases again in US or European countries, India is still battling to get things under control. So, what kind of socio-economic cushion can countries work on so that we will come out of it as strong as possible?
Sorry, I'm not quite hearing you. The audio is a little bit. Can you speak just a little bit
Okay,
again?
am I audible now?
Yes.
So India was one among the few countries which took the decision of lockdown as soon as we had
Yes.
very few cases of COVID,
Yes.
very few
Yes.
COVID cases. But with recent rise in the COVID cases, US and European countries are doing better than what India is doing. And what kind of socio-economic cushion can countries work on so that we can come out of it as strong as possible?
And the answer again is if you get to zero in part of the country and you protect it, then you have the socioeconomic activity in the parts of it that you've been successful. And you can use that to support the activity that is happening in defeating the disease in other places. And this can be done even in urban areas. So if you have the disease in one neighborhood, you can protect yourself, right? Even within city transportation limitations. And we know that the economy is connected. But if we recognize it by doing the best we can to limit the travel between areas, we gain tremendously because the economic activity in the areas that has been protected can support the effort to get rid of the disease in other areas. So there's no conflict between when people do everything at once, they think that the lockdown hurts economic activity. But the lockdown helps because, again, once you get to zero, you can have the economic activity that you need. And doing it fast and doing it strong ends up getting you there. And there's now a report from the IMF that talks about this, makes it clear that strong and rapid action enables you to get the best economic recovery, and the confusion about the competition between doing the lockdowns and the having stopping the disease and the economic effects is just wrong. And now that's just obvious, but before, for some people, it wasn't obvious.
Right, very well said. So, could you also share some examples of trust and cooperation between citizens and the government that can be modeled in India, especially by our organization, Project Step One?
So I think the cooperation arises from the sense of responsibility. The problem is that if the community feels that it's the government's responsibility, then they may be unhappy or angry with what the government is doing. And if the communities are often, in many countries, including in India, there is conflict between communities. So there's often this blame, it's your fault, you're making it bad. But the main thing is that if people realize that they have responsibility for their own community's health, then they can also collaborate with others because they can share and help each other. And so the most important thing is to start with a statement of ownership, of community responsibility. And 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 there are communities around the world, like a village in Italy, that said, we're going to get rid of the disease, and they got rid of the disease. So their action is the most important. And then understanding that we're all in this together. And there are communities recently there's outbreak in New Zealand and they defeated it. There was outbreak in Australia and they're just basically at zero. And there are outbreaks, but again, there's always this firefighting that has to go on in order to stop localized outbreaks. But there's an eastern part of Canada, it's called the Atlantic bubble, where they don't have any cases because they fought it and they have restrictions at the borders. And there must be many places in India where there are very few cases or even no cases, whether it's in villages or whether it's in parts of cities or whether it's so on. And as soon as people realize that they can take responsibility in their community and protect their community from the disease, they can take action. But it's the main thing is that individuals can't do it. So people have to get together in teams and work with neighborhoods and local leadership, the local political leadership, the local economic leaders, the business owners, and the institutions, the medical institutions. But the point is that if the people in the hospitals worry about what's in the hospital, and if the people in the business worry about the business, and the people in the government only worry about their usual responsibilities, and even the military, if it only says, well, our job is just to do military things, then it's very hard to get things done. But if everybody says, look, there's a real problem, there's a challenge that we're all facing, we need to do what we can do and figure out and talk to others and say, you do this and I'll do that because I'm good at this and you're good at that. And then we can all get it done.
Like you said, we have to fight it as a community, right? So, a curious question is: can someone who already has COVID for a long
By
time,
the way,
can he?
let me just add to that. If
Yeah,
people
sure.
want to work on this and want more detailed experience and want to talk to others who are doing this, I'm happy to connect. So if there are groups of people that get together or they want to talk with me about joining groups of people, let me know. Because one of the main things that I'm doing is just connecting people so that they can work together on stopping the outbreak.
Thank you so much. I will definitely put this appeal out and and ask people to come and join, so that I am sure there are people who want to join in as a community and do something for the society. So thank you so much on that, Professor. So the curious question is: can someone who already has or had COVID, can he or she get that COVID back again? How long does the immunity last for?
So the answer is yes. We know that people are reinfected. And since it's only been a few months since we've had the disease, the reinfection time isn't very long. And because there aren't that many cases, right? There's only a few percentage of the population that have been infected altogether. The fact that there are already documented cases means that it's not that unlikely. And the cases that have been identified as being reinfection use genetic tests to see that the first infection is not the same as the second infection. So it's different viral particles, different genomes. And that means that there are probably many, many other such cases. So the answer is that people who have been infected may have immunity, but we don't know how long it lasts, but we already know that people can be reinfected, and we cannot rely on the immunity to protect them. So that's super important thing to know.
So the only solution is to wear mask, maintain social distancing, and all
Yeah.
the basic things that we are doing, right?
Yeah. To rely on immunity is not uh, either practical or realistic in time frames that we know. And this, by the way, also goes for the studies of vaccines. We do not know how effective vaccines will be. We don't have vaccines for any coronavirus. Now, we're really working hard, of course, to get vaccines for this virus. And hopefully it will happen. It will take time both to get a vaccine and to make sufficient quantities of it for it to be helpful. And the more we get rid of the disease, the easier and quicker it will be to use vaccines to help us. So if the disease is widespread, it takes huge amounts of vaccine. But if we get rid of the disease most places, and there's a small area where there's still the disease, we can use local vaccinations to stop it there. And we can use what's called ring vaccination to stop it in the specific area transmission chains in order to stop the disease. And that's what we did in Ebola in the Congo once the vaccine was available there.
Right. So there's one more question which is really common from the last 5, 6 webinars that we are getting, but we could not put this across to anybody. So I'm asking you, Professor, what precautions should be taken if there are pets at home? Because it was recently reported that even the pets were affected by the virus. I don't know, maybe in United States or in some places.
Yes,
So
no, there are definitely different pets, cats and dogs and other pets, other animals that can be infected. Um, so it's very important to take precautions like we take with people to prevent interaction and transmission between people and animals and between animals. So if you have dogs that are going outside, you have to prevent them from interacting with other dogs and interacting with other people. It's just clear, just like social distancing between people, you have to have social distancing between animals. And that's the most important thing. So if cats are wild cats, we have to be protected from interacting with them. And if cats are domesticated cats, we cannot let them run wild outside and come back home because they may bring the disease back and infect the family. It's a big challenge because animals, of course, like people, want to interact with others, and animals are they can't we can't explain to them what the reason is that we have to put them into restrictions. but we have to take responsibility for imposing restrictions on animals so that they don't transmit the disease.
Oh, okay. That was interesting to know. So we've been listening that the coronavirus can live on any objects. It can stay for some time. So how long is the virus live on objects like the mail, or like metal or cloth or wooden fiber or plastic? So how long is this
So,
just a steady?
so first of all, it's important to emphasize that there are only a few studies, and these studies should be repeated. So if there are people who are able to do more research, we should be doing more research. It's hard research because you're dealing with poison, toxic, risky things, but we really need more research on this. But what we know is from the few studies is that on cardboard, it lasts for a few hours, maybe a day. On metal and hard plastic, it lasts for days. So the standard amount of time that we say is that we need to allow on surfaces things to wait for, let's say, 3 days on hard materials, metals and plastic, 3 to 4 days, and say people say about a day on cardboard, but cloth varies. So, for example, on masks, it can take a week is a time frame, and which is really, of course, severe problem. It's also important to know that the conditions matter. So the temperature matters. So higher temperatures lead to more rapid deterioration. And so elevating the temperature for things, or if it's hot out, putting things in the heat, it's much better. And if, on the other hand, if it's cold, then things don't deteriorate. So in a refrigerator or in a freezer it'll last decades. In the refrigerator it may last, I don't know how long, but months, longer than you want to wait. Um, so so room temperature are the values that I've given, but higher temperature. So it's very good to cook foods. So at boiling temperature, it will take maybe minutes, but even at, say, 60, 70 degrees, it can take about 10 minutes for viral particles to deteriorate. So elevating temperature to low warm temperatures can help to lead to deterioration. So time is important. Higher temperature, so low temperatures, but higher temperatures can help, and also soap, as we know, using soap or of course alcohol. So everything that you get, like packages and so on, you should wait, have them separated. If you can, to elevate the temperature on everything, and to use soap or alcohol to disinfect. So that's the dimensions. In addition, it's important to understand that while early on the disease is mostly a respiratory disease, because of viral particles being on surfaces and including on food, and we don't know how long it lasts on different foods because the research hasn't been done. It's very important to take precautions, either using, again, soap or elevating the temperature or even cooking foods, so that when you eat them or drink, you are not infected, because we know that gastrointestinal symptoms can be the first symptoms, and there should be concern about the transmission of the disease. Again, we don't have a lot of data to say how much or what circumstances or what kinds of foods are more dangerous. And because we don't have enough research, we should be very careful.
So we have one question from the viewer, Suresh. Mr. Suresh is asking, how will the vaccine work? How long immunity will last with the vaccine? I think you've already answered that question in your talk, but if you want to put in some
We
words more.
and the answer is we don't know.
Yeah.
There's a real importance to a balance in a context of risk. People want to be reassuring of others. We don't want people to panic, right? People say, hey, we don't want people to panic, but on the other hand, we don't want to give them false assurances. Because if we give them false assurances, they won't act in a way that will be safe. It's like saying to someone, hey, it's okay, don't worry. The fact that you're, near a cliff, don't worry, And the answer is we do not know whether vaccines will work. We are hopeful that the knowledge that we have about vaccines will enable them to work, but we cannot rely on it, and we don't know when it will happen.
So one more question from the viewer is there any research on why long COVID is seen in some patients and not in others?
And the
Is there
answer is
any study that says that?
we don't know. It's reasonable to expect that there are a variety of differences. One has to do with genetic differences, health differences, exposure, differences of exposure, and differences of treatment, and so on. So, if there's one exposure, a small amount, if there's many times exposure, if the treatment is different, is whatever, there are going to be a lot of differences that we don't know yet, and it's going to take a while to find all those things out.
Okay. So we'll take one last question before we end the session. So Dr. Sarpreet Singh Gill is asking, what is the current chance of a second wave?
So the problem with thinking about second waves is that the whole idea of waves starts from human diseases. So a human disease comes in waves because of the natural dynamics of the disease in the population, the seasonal properties, and so on. With the coronavirus, with COVID, it's mostly about what people are doing, whether people are taking precautions, whether they're opening up the economy. So it's really mostly driven by that. And there may be some seasonal effects, but they're secondary to the whether or not people are taking social precautions. So even calling them waves is not the main story. The main story is, did you get to zero? If you got to zero, then there isn't a second wave, right? Waves only happen if you have the disease. So this whole idea of waves and the natural dynamics of the disease is not as important as the choices that we make as a society in responding to the outbreak. We have control. We have the knobs to turn. It's like, sitting at the wheel and saying, well, what happens if the road curves? The answer is, if you're in control, you will be able to stop the outbreak. That's the most important thing.
Right. So to end the session, what is your take-home message for our viewers and everybody who's watching this?
So first of all, it's us. It's what we do. But the fact that it's what we do means that we have to work together. Individuals cannot stop that. They can take precautions themselves, but that becomes a tremendous burden over time. But individuals should take precautions. But then if the community takes precautions, it can make the environment safe for individuals. And the larger the area that we take the strong actions, the more normal will be the life that we will have. So by working together with others and supporting each other, we can do the best possible in order to stop the outbreak and to restore normal life that is what we all want. And the sooner we do it, the better, the fewer the people that will be sick, and the fewer the people that will have long-term consequences that unfortunately we're learning can be very severe. And again, having people understand the severity of the long-term consequences, the heart effects, the brain effects. There's a recent study that shows that people lose as much as 10 points on an IQ test, which is a huge amount. But even mild cases have significant effects. And all of the other effects that are happening, we want to stop it. And the sooner and the better we stop it, the more we take precautions, the more people understand the need to take precautions, the better. And the volunteers that are working on the telemedicine and other volunteers are really the backbone of the response effort, because the existing institutions, healthcare institutions, are not capable by themselves. The government doesn't always understand what to do. We need to recognize that we have to take stronger, not weaker actions. We need to take responsibility and have ownership together of stopping this outbreak in order to have the best possible outcomes for ourselves and our families, our friends, and for everyone else. Thank you.
Thank you so much, Professor, for your patience to come here and answer so many questions. It's always been a pleasure having you on our panel, and we look forward to having you again here anytime that you're free. Thank you so much, Professor, for joining in.
I think the next agenda item is to find out from your viewers if they want to organize, if there are other things that they want to do that they need information for, and ask them what help they need, and I'll be happy to participate again in a call. But more importantly, I'll be happy to listen to what they're saying about what they want to do and see if I can be of help. That's the best, most important thing that I can do.
Sure, Professor. We'll be arranging that session soon, and you can listen to all our. We'll try and get all our step one doctors on the panel so that we can all have a great discussion there. Also, volunteers, force that we have. So we'll be picking up a few, and let's all have a wonderful session then. Thank you
Thank you
so
very
much for
much.
joining.
Take
Dear
care.
viewers, we will have one more session coming soon. So stay tuned and follow us on Facebook, Instagram, LinkedIn, and Twitter. And do not forget to visit www.projectstep1.org for more information on Project Step 1. Thank you so much. Thank you, Professor.
Take care. Bye-bye.
Bye.